constant touch with us. And it's a pleasure to thank and welcome the participants today, the faculty, who are the most important people who would be carrying forward the torch of spreading the knowledge that is bound to spread through this kind of educational institutes. I thank the organizers of this beautiful faculty development program also. And with that, I would like to start with the presentation of osteoarthritis, its management, and especially with the focus on the geriatric care. So, more than enough has been said about me, about my name, my degree, and where do I work. So, I would like to have a little more introduction to the place that I work, the Center for Sports Science, one of its kind in India, so that the participants, the faculty are aware of what we do. So I'd like to begin with a small video about how teamwork is important in sports science. We have just witnessed a pit stop, world record pit stop change by the Ferrari team, which it did within just under 2 seconds. Just under 2 seconds, the four tires have been changed, fuel has been put, driver has been replenished, and the car has been serviced, and it is ready to go into the sports track to go and win the race. This is what probably our athletes need also from us as sports science, physical education, sports medicine, coaching. As a team, we have to work together in a very quick time, also in a sophisticated way, to bring our athletes back to top performance to compete against the best in the world. So this is one of my favorites video, just shared to show how important is teamwork. So going on to the next slide about the CSS, it is we are in the southernmost part as you are in the easternmost part of city in the Chennai. And what we do is we have opened this center in 2014, but our university is 35 years almost old university. Through sports medicine and related services, through sports education and applied research, and most importantly, through the collaboration with government and the reputed universities like Rajiv Gandhi University and other stakeholders like sports organizations, sports teams, we wish to make India succeed in the sporting world. Infrastructure wise, we are very grateful to the Honorable Minister of Sports who had visited recently. I know he spoke about the infrastructure and facilities available here during the inaugural session. That shows his kind heart. So we have invested in a lot for the high performance centers, the fitness centers, and the indoor sports arena with outdoor sports playing fields, swimming pools, hydrotherapy pools, sports science labs, including isokinetic exercise physiology labs, and even the foot. Also, we have a separate lab to test them and provide them custom made orthotics to perform better, and a high altitude training chamber. So we all know we don't have a lot of mountains here in the southern part, at least in Tamil Nadu. So we want to bring the mountain altitude to the athletes. It can go up to close to 6,500 meters. It's the latest Australian system that we have installed here. And one of the USPs of our center is the probably the largest biomechanics, sports biomechanics lab in the Asian continent. We have more than 20 number of infrared cameras and force plates, EMG machines, and some state of the art facilities coupled with experts in biomechanics, both in India and abroad. They take a key decision and improve performance. So these are some of the international experts from South Africa, and we have a lot of other experts also from Australia, UK, Malaysia joining us. So from 2014, we have been associating with international organizations and national organizations like Sports Authority of India, Sports Authority of Tamil Nadu, and Kerala Sports Authority. And we have tied hands with BCCI, All India Football Federation, Rowing Federation of India. And also we've been partners with ISL teams like Chennai FC, Hyderabad FC, and some local teams, and also some leading sports associations like Gun for Glory, Mr. Gagan Narang's Gun for Glory Academy shooting. So they are also our partners. So this is how we see we handhold with international organizations and sports bodies to make some change, positive change in India. And this is our team in CSS with doctors, physios, trainers, sports medicine, sports uh, nutrition, psychology. So we have all of them here. What we do is a holistic, comprehensive athlete assessment with all these specialists and provide them inputs so that they can perform better without injury risk and in a best state of health. Sports education wise, as has been mentioned, we have had an MOA now with Rajiv Gandhi University through which we'll be sharing our experiences and expertise through sports science and sports medicine for the undergrad, master's courses, certificate courses. And as in my introduction, they had mentioned that we, for the first time in India, the University of Sri Ramachandra started the MD Sports Medicine course. So I was there and took the course. So the credit goes to our university rather than me. And it's a new courses in 2020 we have launched along with the Sports Authority of India, NAS Patiala, advanced certificate courses in sports physiotherapy and sports nutrition, and many more certificate courses are coming up. The first two courses have been completely filled, huge response there. What we have planned to do is here is to bring international expertise and give online education given the pandemic situation now, and just 2 weeks of face-to-face training either at NS Patiala or CSS in Chennai. So through 5.5 months, they'll be having intense online content delivered to them. So this is the way forward to go, we think, is because of the pandemic situation. Even existing professionals can upgrade themselves and upskill themselves. So we do quite a bit of research work also. As you can see on the top is anti-day knee pain, which is one of the causes for the osteoarthritis. We have PhD students who have completed their topics on this. And we have varieties of research projects going on through our PhD students and postdoctoral students and various other organizations. And previous sports minister from also from your land, and he was there to grace the occasion when Sport Authority of India recognized as a center of excellence in sports sciences way back in 2014. This is when International Cricket Council visited us the next year and gave us the accreditation. We are the only lab in the Indian country to do testing for ICC, and we are the first and only accredited center for excellence for Asian Football Confederation, through which we deliver sports services and sports education. And as we said, the biomechanics is one of the forte of our place, and we use it for cricket. As you can see, the athlete will be uh, placed with a lot of markers, and these cameras will capture his image, and he lands on force plate that will give a lot of details about the forces being transmitted, and this will be analyzed and given reports to improve their performance, not only for cricket, for tennis, for running, for football and rowing. We can apply this to so many other things. So we have a exclusive rowing center, first in Asia with floodlights and artificially man-made lake. As you can see, you can row in the nighttime also using floodlights. And we have imported equipment from Australia, which is being used by the Olympic gold medalists. So that has come now to India. We train our rovers with this sophisticated testing and training system. And cricket isn't big in India, so we cannot escape from that sport. So we brought in the best coach, Mr. Da Watmore, who's been heading the cricket academy with some new equipment and coaches. Mr. Gaganarang is there with us as a director for the Shooting Institute. And we have world champions being made here. On the top right, you can see the current world number one in 10 meters rifle, Miss Ilavenil, who trains from our Center for Sports Science. And as we said, we are football partners for Chennai FC and Hyderabad FC. All their international junior, senior players come here for treatment, testing, sports science needs. And we have one of the best football grounds in the country, FIFA standard. And we have other academies in basketball. And recently, we opened the hockey academy, for which our Honorable Minister for Sports graced the occasion, inaugurating the hockey center with our former Olympic gold medalist, Mr. Bhaskaran, the former Indian captain. He is with us as the director of this center now. So we are the only academy in Tamil Nadu who have multiple sports recognized by Khelo India, and we have rowing, weightlifting, shooting academies here. Again, a lot of champions are in the making. So there's a short video which will show what we do. Just 60 seconds. All this shot inside our university.
ആകാൻ വേണ്ടി മണിക്കൂറുകളോളം ബോട്ടിലും ജിമ്മിലും എനിക്ക് കഠിനമായി പരിശീലിക്കേണ്ടി വന്നു. മത്സരത്തിൽ ഓരോ മില്ലി സെക്കൻഡും വിലപ്പെട്ടതാണ്. ഇനിയും മുന്നോട്ട് പോകാൻ എനിക്ക് ശാസ്ത്രീയ പരിശീലനമാണ് വേണ്ടത്. എന്റെ ടെക്നിക് ഇംപ്രൂവ് ചെയ്യാനും എന്റെ ശാരീരിക ക്ഷമതയുടെ പരിധി വർദ്ധിപ്പിക്കുവാനും ഓരോ സ്ട്രോക്കിന്റെ വേഗത കൂട്ടുവാനും ശാസ്ത്രീയ പരിശീലനം എന്നെ സഹായിക്കും. I am ready, India, ready to win.
So that's how we wish to prepare for Olympics or athletes. Now, coming to the main topic of osteoarthritis. So I would like to start the session with an interesting question. So on the left, you see a great basketball star, Kobe Bryant, and on the right, we see the highly revered Pope John Paul II. Both of us are not with us anymore. But what did they have in common? So today's topic they had in common, and entirely two different types of people, but had the same problem. Why and what was done and what is to be done is the topic for the day. That is osteoarthritis. So we'll discuss about what is osteoarthritis. It's epidemiology. Now everyone is aware about this epidemiology term because of the COVID. So the virus pandemic has brought epidemiology back into focus, and the distribution of the disease, how it affects the different parts of the body, and the cause, that is the etiology, and the risk factors. Because once we know what is causing this, or what is the risk factor which can cause this osteoarthritis, then we can plan to prevent that. As we know, prevention is always better than cure. So the cause for etiology or risk factors help us to prevent and also to manage better. Once we know why it has come, then we can manage accordingly. And the term called pathogenesis, pathos abnormal, genesis, how it is developed, how it develops over course of time, and what are the clinical features, and for medical people how we can uh, diagnose it. And there are some other conditions which can look similar, but they are different and they have to be managed differently, and the investigations and then management. So I'm very aware that we have a mixed population in the faculty today, not only medical, mostly non-medical people are also there from different subjects. So I'll try to uh, use mostly non-medical words, common words, to make the understanding a bit better. So osteoarthritis, OA, as we might be aware, is used to call and other names also like osteoarthrosis or degenerative joint disease, DJD, hypertrophic arthritis or degenerative arthritis. So there have been different names, but I think scientific world has agreed to use the common name called osteoarthritis for this condition. Coming to the epidemiology, it affects mostly knee and the hip joints because they are weight bearing. In our country, India, we have more of a knee arthritis, osteoarthritis, whereas in Western world, they have hip joint arthritis more common. This may be due to some cultural reasons and some genetic reasons. The way we sit on the ground more frequently, we squat on the Indian type of toilets, or we used to do. Nowadays, we are having more Western type of commodes. And the age, mostly it affects people of the elder age group, more than 65 years. And most of them have X-ray features. And the good thing is not everyone is affected by this disease. You may have the disease, but only one-fourth of them will have symptoms. And it's more common in women actually. And it has got a familial tendency. If dad has got it, maybe son might get it. So that is about the osteoarthritis. So as we saw, knee joint is the most common joint involved, at least in India, in our country. But in Western world, the hip joint is more involved. Hands are also involved, and as well as the feet. So it can affect all joints, but generally these joints is mainly affected. So it can be idiopathic or primary. When there is no obvious cause, it can come on its own. So one of my professors used to say, when you say idiopathic, the doctor is the idiot and the patient is pathetic because you don't know the reason. So he used to jocularly say, so I still remember that word. So, but idiopathic is a medical term wherein there is no cause for the disease found out. And secondary is where there is some factor. Because of that, this changes have occurred in OA. So these two types are there. And when it comes to secondary osteoarthritis, there can be many factors, like right from some children are born with some deformities, so they can get osteoarthritis, some endocrine problems, some accidents or injury to the bones and joints can cause this problem. Occupational sports is an occupation where repeated injuries occur, especially footballers, basketballers. So sports is it's an occupational hazard for osteoarthritis. And some people, when they injure their meniscus in the knee, we may have to remove it. That will cause osteoarthritis in the long run. And some diseases like inflammatory disease, we would have heard about rheumatoid arthritis, gout, or septic arthritis when the knee joint gets infected. So all these things can also in turn lead to osteoarthritis. So arthritis is a very big umbrella term under which we have varieties of arthritis. The most common one is osteoarthritis. So osteoarthritis can be without any reason also, but it can come with these secondary reasons also. So there are other diseases like metabolic or aseptic necrosis, some nerve diseases. So it is a bit medical. So medical people, they'll definitely understand this. So the aim of the slide is to make us understand that there are some medical causes, non-medical causes, which can predispose people to osteoarthritis, secondary osteoarthritis. But it can come without all these factors also on its own. Let's see why. As we discussed earlier, the risk factors we have to know because we can prevent, or if we cannot prevent, at least we can manage better once we know the risk factors. Heredity is definitely one. Gender, hormonal status, we saw females are more affected. Obesity, so if you have high body weight, definitely it is going to affect you more. High bone mineral density can also be a problem. Mechanical factors like accidents or injury, fractures. Sometimes the joint shape itself, if it is different, joint alignment is different, you may get this problem. And as we discussed, occupational or recreational sports, and in some factories which require prolonged standing or jumping, so all this can cause. But as we see in the center, aging is a common factor for both, and aging is in fact a main reason for osteoarthritis because age-related changes occur, which we'll explain in the next few slides. So invariably, like graying of hair, joints also tend to wear out. Now let's look at a proper joint, how it looks like. So we see two bones and they are joined. And that's why we call joint. And apart from the bones and of course the muscles surrounding these, there are some special structures in the joint. So they are there for a purpose. The most important part that we have to note in relation to osteoarthritis is this particular tissue called cartilage, articular cartilage. So it just forms a coat over the bones in the joint area, and it's a very soft structure and it acts as a cushion and lubrication when the joints bones move against one another, so it provides smooth movements. And then we have joint capsules here because joint cavity is there, some fluid is there. So we have some nice mechanism here wherein the joint functions smoothly. The bones slide against one another very easily and in a smooth way. And of course, there are some other structures like bursa. They also are there for making the movements smoother and easier. What happens in osteoarthritis is the articular cartilage is progressively gets destroyed and it is lost. As we can see, it gets ragged and slowly it gets destroyed. So then the bone underneath or bone near the articular cartilage also undergoes degeneration. So this gives rise to some X-ray findings. Like basically, this part becomes problematic, the joint problem, both the articular cartilage and the bone underneath, and sometimes it affects the capsule and everything. The entire bone gets affected. So little more detail up to electron microscope. Let's go and see. So this is the joint, and we have a coat of articular cartilage here, and there are chondrocytes. Chondrocytes are the cells that make the cartilage. Chondro is cartilage. So cyte is cell. So chondrocyte is the cartilage cell. And inside that, if you have microscope and see, you can see a lot of structures. And if you expand it further and see in electron microscope, we have different structures. Body is a most wonderful machine, and joint is also very fascinating. So we can see inside this extracellular matrix, as we call it, apart from the cells, in the extracellular matrix, in the fluid that the joint has, we can see a lot of things. So one is this chondrocyte, that is these cells, but in the fluid we see a lot of other things like hyaluron, one linkage kind of protein, very important, and then aggregans, collagens. So there are a lot of things are there, and they have been extensively researched. What happens is the chondrocytes are normally protected. This is the chondrocyte. These are the protective mechanism, extracellular mat, and collagen has to be there. If collagen is not there properly, then the cartilage gets damaged and worn out. And we all know that body can repair itself, but collagen is almost, it is still repairable, but it takes 400 years at least to get itself repaired. That is why once the joint cartilage is damaged, once arthritis has set in, we cannot expect the cartilage to grow or the joint to become normal unless we do some surgery or something. So the joint structure is permanently damaged. That is why we have to take caution. So the chemical process is the proteins get damaged, and the structure called glycosaminoglycan, it gets damaged. So that is the process of OA. So we need to understand this to manage it medically. So the unhealthy joint becomes like this because of either biomechanical problem or metabolic problem or age related simple degenerative changes or trauma. So these lead to the loss of the joint homeostasis. Homeostasis is a perfect state in which everything is in balance. So that when the balance is tilted, this problem occurs. And research is now shown that there is a particular person who is responsible, who was called cytokine. So we would have heard about the cytokine because again about this COVID, we would have heard about cytokine storm. That is what is killing the COVID patients nowadays. So when some abnormal, not abnormal, the chemicals are excessively produced in the body and they affect the organ systems. So likewise, in joint also we have cytokines, which when they are released at the wrong time or in a wrong manner, they cause inflammation, and then it causes denaturation of glycosaminoglycan, and then ultimately osteoarthritis. So that's a chemical process. So cytokines, again, we would like to focus a bit more because latest research shows that by doing something about cytokines, we can help the osteoarthritis joint. What are cytokines? They are produced in joint tissues and released in the synovial fluid. So they act on the cells. This is the chondrocytes, and many of these are necessary at low levels for normal joint functioning and balance. In cartilage problem, what happens is there is an imbalance in the cytokine amount or activity. How it has happened? So there are some always in here, like in human beings, in chemicals inside the body, there are also good, bad, ugly people. So the good cytokines here are listed here, interleukins, a lot of them. So these are good cytokines. But there are controlling people are also there called growth factors. So they help us in various ways. They are generally angels, and sometimes they can do magical repair also. And these fellows, regulatory fellows, are also there. some interleukins and other chemicals. And there comes last our bad guys, TNF alpha, interleukin 1b. So there are again various chemicals, but all of them are not always good or always bad, because generally depending on the time and the amount of their release, they can act in a different way. That is why we call balance. So in correct time, in correct quantity, in correct fashion, if these cytokines come, they help. In wrong time, in a wrong manner, in a wrong amount, if it is released, that is not good to the body. So this is about the balance. So among the VIPs are shown here: interleukin 1RA and interleukin 1 beta. So this guy is a good guy and this guy is a bad guy. And what happens is, when there is a good balance normally happens, so the controllers and good guys keep these bad guys in control. These bad guys are also needed because they do a particular job. But when this balance is tilted, when these people take more control, we have this arthritis problem resulting. So if we can see this half of the joint is a normal joint, you can see super smooth cartilage and nice structures. And when this bad guys take over, we can see all this cartilage disappearing, bones becoming rough, and bones spiking, the joint becoming more disorganized, capsular thickening. So a lot of degenerative problems happening. The entire joint gets remodeled, and you can see people walking with bent knees and all. So the clinical features are mainly pain, mainly activity, weight bearing related. Slowly happens over a period of time, but sometimes it becomes permanent. There may be only one joint or multiple joints also can be involved. When you get up in the morning, they feel stiff, and then later on they become better. And the functions are getting also reduced because of either the capsule gets thickened and the joint becomes tough, or the extra bony growths, they block the movement. So how we diagnose this thing is through the clinical findings. As we can see, generally in women in hand, we can have all these features with some nodes and all. As we mentioned, the knees can be bent also because of this problem. So mainly, it targets the knee joint, about the tibiofemoral joint, or the patellofemoral joint. There are two joints in the knee. So it can cause the varus deformity. So in hip, what we see is a different setup. People have pain in more of the left side of the hip or in the groin. And then there is a antalgic gait, that is painful walking pattern is there. And wasting of muscles, weakness, and the pain related to the hip rotation. And sometimes when you flex the hip also, it's painful. During there's something called early onset OA also. Not only aged people get, younger people also get, especially the sports people also can get before the age of 45 years also. But the symptoms are the same. So X-ray is still remains one of the best methods of diagnosis. As you can see, the joint space, as we call here, is reduced here because there is cartilage here and there is no cartilage here. That is why bones are rubbing against bone. The bone shape is changing. There is some extra new bone is growing. So a lot of all these things we can detect in X-ray, and we can stage the grading also. So this is called extra bone growth. We medically we call it as osteophytes, and this also you can see they are becoming more sharp here. And in the wrist, we can see osteoarthritis can come. So the bones become like cavities also here. So that's painful actually. So we do some blood tests. Generally, they are all normal. The blood test which is done to rule out rheumatoid arthritis, because that's a different arthritis, needs a different treatment management. So that factor will be negative. And generally all the tests will be negative because it's age-related degenerative change. Coming to the management, once we understand all these things and know what is causing it, accordingly we have to manage. We call this a pyramidal approach. Our strategy to OA, we cannot treat everyone in the same way at every time. So surgery, as you can see, is the last resort on the top, but it's still last. The most widespread thing we can do is what is called as weight loss, exercise, and lifestyle changes. These are very, very, very important. That is why we all know the Fit India movement has been launched. Recently, the Independence Day, the Honorable Minister has launched Fit India Run programs, Fit India Youth Clubs. So all these things will definitely help once we reduce the weight and becoming more active. That itself will cause a good joint. So that is very, very important. Then once it is not controllable through that, we may have to give some medicines, or they may have to come for physiotherapy. We may have to give them some splints, braces. So that also we can do. And now some new method of treatment has come where some new injections have come. So previously we either had only surgery or medicines. Now there is an intermediate thing, non-surgical injections also come, which can definitely help the osteoarthritis patient. So that we are going to discuss a bit detail because these are the new developments. So non-medical treatment, what we should do is first the patient has to be made understood the condition, that it is not a disease but it is a process, and we need to tell them few things like proper sleeping position, sitting position, and we all know that through proper ergonomics, but most of us don't follow that. The furniture has to be adjusted, the chair, the toilet seat, everything is important because we spend a lot of time on all these things. So once the osteoarthritis has set in, the repeated movements of the joint, especially bending, has to be minimized. Otherwise, the degeneration will occur faster. So weight reduction is very helpful. Exercise. People will say that I have pain, I cannot exercise, but definitely we can do different type of exercise. The yoga is good for this kind of people because it is mild and it is not stressful on the body, but still it does all the stretching, strengthening part. So people can follow up yoga or according to their doctors or physiotherapist recommendations, they can do some good training. So basically they have to build their confidence. And exercise, we all know that there are muscle strengthening exercise or aerobic exercise. So all these things we need to uh, advise them. So here is where the physical education people come into focus, and they can do a lot of things to reduce the osteoarthritis problem. Yeah. Other things like we told about the braces, there are some simple braces to very costly new braces available, which can apply push force or pull force so that the joint degeneration can be minimized over a period of time. Again, we have to be very careful about choosing the footwear, and footwear with some medial arches and some soft materials. All these things are recommended, whereas fancy high heels are all sometimes counterproductive. Medications wise, paracetamol still remains the most commonly used tablet for osteoarthritis pain. There are some opioid tablets are also good, especially in long terms. NSAIDs are non-steroidal anti-inflammatory drugs. Like popular one must be Brufen, you all know that, or Voveron. So these kind of drugs are called NSAIDs, non-steroidal anti-inflammatory drugs. So they are also used. On the skin also we can apply capsaicin. It's nothing else but chili. That chemical from the chili, it's capsaicin. That also helps by counter irritant mechanism. And there is this what we are going to talk about, joint injections. So because they come under the pharmacological therapy, either you can take orally or you can take that injections into the joint and that can relieve this. So there are a lot of options. This field keeps on changing. Many of us would have heard about platelet-rich plasma, and some of us would have heard about stem cell therapy and steroidal therapy. So we don't use steroids a lot nowadays, and hyaluron is again a good injection. So these are all approved already, and what we are going to talk more about is a chemical called ACS, because that shows a bit of promise in probably reversing osteoarthritis or arresting the osteoarthritis. If we can see this, all these are blood products. So the platelet-rich plasma, if we see compared to the whole blood, has a little more of platelet. Ideally, it has to be 8 times more, but sometimes we don't get it. And it's basically we enrich the blood with more plasma and less red blood cells. And ACS, whereas it has got uh, this ready-made products like anti-inflammatory cytokines and some good growth factors. So this is where a lot of research has been done and it has been encouraging. Again, platelet-rich plasma also has these things in a crude amount, but there is no standard way of confirming this. Whereas ACS is more refined process where we'll get good active products. So it has developed lately in the late or mid 90s, and then the blood from the own patient, 60 ml, it is taken and it is processed, and when it is released, it has got 140 times of good this cytokines, and it can be injected twice a week for 3 weeks for it to act better. And this are some research work which shows that ACS functions and works better. The mechanism is that anti-inflammatory cytokines, they help in correcting the imbalance over the surface of the cartilage. So these are some pictorial representation about how they arrest the progression with a possible shift to regeneration. So it can be given in stage 2 and stage 3, but in stage 4 it is not helping, and it can be given in other conditions like disc prolapse, muscle tears also. So it's a very promising medication rather than biological injection, and a lot of research is also going through that. It's a simple technique. Studies have been done in horses also because they need a good joints, and they have shown improvement also in dogs, and also in human studies also having shown good improvement. Uh, the reason for showing all this thing is now medicine is going evidence based. We need to do research and prove the effectiveness of any intervention. So ACS, the autologous chondrocyte serum, seems to be the only product right now which is helping in a scientific way in injection. Of course, when everything else is failed, we have to hit the red button, the Brahmastra, as we call it, go for surgical treatment, where we either do a chipping of a affected bone to make the alignment right, or do the joint replacement, or the total joint replacement. Either you can do a single component joint replacement, or this cup or this head, or you can change both. This is in the hip joint. Similarly, in knee joint also is very common. So you would have heard about people who have new knees. knee joints, metallic knee joints. And it's a very effective procedure, but it takes time, cost, long rehab period, and post-operative pain. And it is not permanent also. After 10 years or 15 years, you may have to redo the operation. So that's the plus and minus of this operation. So coming to the first question about what was common between these two great men was both of them had osteoarthritis, and for different reasons, of course. Reverend Pope John Paul, because of his age and degeneration, and the great Cobrain because of the repeated movements, repeated trauma, and repeated forces traveling through his knee joint. He had the osteoarthritis, and both were documented to have this injection of ACS done into their knee joints, and they had pain-free or reduced pain in their knees for quite long time after the injection process. So that is an interesting story. So osteoarthritis can affect not only the aged geriatric population, it can affect the young and very active people also. So in summary, the osteoarthritis is multifactorial. It comes due to very many reasons and sometimes no reason at all. The main reason seems to be age, and the reasons behind it, if we can go into molecular level, it seems to be because of some imbalance in some chemical mediators like cytokines. And if possible, we can do something about the cytokines, and injection therapy can be done. But mainly, we have to focus on lifestyle changes, like including weight management, weight reduction if we are overweight, activity modification, good rehabilitation using physiotherapy, medications as needed, and novel injection therapy. And when everything fails, then surgical treatment can be done. So that is how we would like to summarize. And thanks again from the Center for Sports Science, Sri Ramachandra Institute of Higher Education and Research. And if there are any questions, I'm more than happy to take it.
Thank you, sir. Dear participants, sir has clearly explained about the factors and the consequences of osteoarthritis and how we can manage the consequences of osteoarthritis. Do you feel that if you have any doubts regarding management and prevention of osteoarthritis, please feel free to ask from our expert. Over to the participants for your questions.
Hello, sir.
Yes, ma'am.
Very good afternoon, sir.
Good afternoon. Good afternoon.
Sir, I have a question.
Yes, please.
Sir, being a sportsman for last 20 years,
Okay.
now some problem is coming out. So I'm very intensive trainer when I was a sports person.
Okay.
So I have a problem in metatarsal and joint in my foot.
Okay. Okay.
So I done here is only I have option to the X-ray. I go for the X-ray here.
Yes.
So it's nothing coming out. What it may be the factor for this, and what precaution I should be take?
Thank you very much for asking this. And as you had correctly mentioned, you have taken an X-ray, which is the first step. And
Yes.
as we also know, it is multifactorial. We may have to test you further, probably the musculoskeletal examination, including sometimes the leg length also can be different. A physio has to test you, and the muscle strength, any joint, other problems is there. Or it could have been there because you had some small injury in the foot, and then it later on it became worse. So first step is to have a medical consultation with the orthopedic doctor, who would clearly rule out this is not rheumatoid, this is not any other arthritis, but it is not gout, but degenerative osteoarthritis. So diagnosis has to be made first. Osteoarthritis, yes, we can think, but other things have to be ruled out, like rheumatoid and other things. Once it is ruled out and we know that it is osteoarthritis, then treatment management, as we know, since your foot is a weight bearing area, we need to see how we can adapt or reduce. Maybe you may have to use a cushioned insole or some special insole where a gap is made in the portion where you have pain. So the other parts of the foot will take the pressure and the affected portion, the arthritic portion, will be relieved. So insole, custom insole can be another option for you. And then some simple treatment like either hot water fermentation or icing or some simple medications here now and then can help you. So this, since the factors are different, we have to treat it differently. And in very rare cases, when the pain becomes very severe, sometimes the doctor may choose to give you some special injections, as we discussed also. It could be a steroid injection or some other injections, newly come injections. So, first thing is to please talk to your doctor, completely get it confirm that it is osteoarthritis, not any other arthritis. Then you have to have a good physio evaluation, and probably you might benefit from the good insoles, soft insoles, and strengthening of the other parts also. So it's a big question, and answer is also very big. But I hope we can start a good journey by consulting the doctor and physio first, who will guide you properly.
Thank you, sir.
Thank you. Welcome.
Um, any more queries from the participant side? Because nowadays either it is sports person or either it is a non-sports person, osteoarthritis is being a very common thing in our life. So if you have any queries about its management, please feel free to ask. You have an opportunity to explore.
Again, my teachers in medical college, they say that once after my lecture, there is no questions. There are two possibilities. One, the lecture is excellent, very good, everyone has understood everything. Otherwise, it is post lunch session, everybody is sleeping.
No, it is the other way, sir. The first one. Seems it is first one, sir.
Hopefully, thank you.
Sir, I have one. There is a relation between gender and occurrence of osteoarthritis because according to my knowledge, females are more prone to being victim of osteoarthritis, especially after the menopause.
Yes. So you are correct. So there seems to be a connection with that also, because after menopause, the bone health itself becomes deficient because of less hormones. So when the bone itself is weak, obviously the joint also goes in for easy degeneration. The second factor, probably, at least in India, the men generally are more mobile, go outside, do some kind of activities, whereas more women are homebound, house, they are housewives. We should not call housewives, homemakers nowadays.
Homemakers, yeah.
So less activity, that could be another factor also. So it is again, problem may be multifactorial. And also sometimes the women don't complain that much easier. They say that, okay, my grandma had pain, my mother had pain, I'll also have pain. They tend to ignore things. And gents, when they have these problems, easy, they'll go out and consult someone. But women making time and coming out to meet a doctor and all is sometimes a big task for some people. So all this probably is making our better gender or better house more risk.
Thank you, sir. Any
Sir,
more queries?
I have one more question after
Yes, madam.
it's coming to females. Sir, some of the ladies come to me for their fitness training and they start walking also. They most of them are the 45 plus. So lots of complaint is they start have knee joint pain. What I can suggest them is only to put the Nikkei while for walking. There's any other suggestion or feedback to give them or precaution for walking?
It's an excellent question. Walking is the number one exercise in the world because it is cheap, it is no cost, it is easy to do. You don't need any equipment. Sometimes a good shoe, or even that is not needed. You can walk with a good sandal also. Unfortunately, that's a weight bearing exercise, so people with osteoarthritis will have pain. So, ideally, if they have any other, say, like cycling or swimming, they can do. But if they don't have, still they can walk. But here we have to take a little bit more care in doing two things. One, we have to assess for any stiffness or any weakness. These are the two things. The stiff parts are normally hamstrings, calf muscles, and the iliotibial band. Once we release this stiffness, once they do the stretching, or sometimes the Achilles also is very tight. And strengthening part, definitely their quadriceps, their glutes will be very, very weak. So initially, we don't ask them to walk, but do some stretching and strengthening exercise and icing or hot pack on the knee. So they'll be in a better shape to undertake walking. So once they develop pain towards walking, they develop an hatred. So it is better if we don't ask them to walk straight away, but start with a stretching, strengthening, and a good self physiotherapy, like the heat or cold, they can do themselves. And once they are a little bit better, they can slowly start walking and increase the distance gradually. And they'll find the benefits of the walking. So your question is very great. Answer is actually very simple.
Thank you, sir.
Thank you.
Hello, Vivek. Hello, sir.
Hello, sir.
Sir, I want to ask one thing that nowadays in rural areas,
Yes, please.
osteoarthritis patients are going toward homeopathic treatment.
Yes,
Is
sir.
the homeopathic treatment is good, or they are saying that they are getting more relief than the medicines they are taking from allopath? Is the homeopathic is good for osteoarthritis or not?
Sir, I would like to answer from two angles. First, I would like to
Yeah.
answer, ask you a question. Have you worked for any TV channel or newspaper?
No. I'm teacher, sir.
Okay. Because the news TV channel people, they ask this kind of very interesting or burning questions, sometimes controversial also. Okay. Number one, since I'm only an allopathic doctor, I don't have any experience in homeopathy. I cannot comment about this or answer your questions. But point number two is osteoarthritis is a age-related mechanical degenerative change with some associated inflammation and all these things. So whether it's allopathic or homeopathic, probably there is no cure to it. If there is some cure to osteoarthritis, then that medicine or that system would have been become great because crores and crores of these people are suffering in India itself. So that itself shows that there is no one single magic system of medicine or medicine itself for osteoarthritis. And second thing is the patient's belief in one system or one doctor itself can cure or can at least remove the pain from their mind. So if they are feeling good with the homeopathy, they are becoming better. Yes, everyone should be happy about it. Let them continue. And we cannot definitely say which system is better for osteoarthritis. And every system has its own positives and negatives. And depending on the condition, depending on the patient, depending on the availability, we can make recommendation. There is a Ayush department is also there. Definitely, each system will have its own advantages. If the patient is happy, please leave them with the system.
Okay, thank you.
Welcome, sir.
Sir, sir, I want a medical advice, sir.
Yes, please, sir.
Sir, actually, during this pandemic, I've been started running and walking. So
Great.
last Friday, I think most probably I pulled my or strained my this thing, vastus lateralis, the
Okay.
side, what we call in common
Yes, yes.
language, the side thigh. So there is a pain inside my muscles. So of course it has subsided, but still I cannot the mobility of my what to say my knee is around 80%. I can it's about to touch my gluteus. So but it has improved. But then how can I quickly come back to action?
Great. This is what every sportsman will ask the sports medicine doctor. So actually, the muscle tears are good in the sense that they are not bones. They don't take long time to recover. They recover very fast. The one thing that we need to do is to find out, if possible, the extent of muscle damage using nowadays simple scans like the ultrasound scan, which just takes 2 minutes. In a good hands, the doctor will tell you, okay, you have grade 1, grade 2 tear. In this portion, there is 1 centimeter
Okay.
gap. So things like this will help the sports medicine doctor and the physios to make a plan. Okay, you have this much tear, you need 1 week complete recovery from this running activity. But you can do other activities like upper body activities, things
Yes.
like that. First
Yes.
one is to determine the amount of damage that you have.
Yes.
If there is no tear, there is only a strain, probably a few days of icing, stretching will help you. And the pain that you have is a great indicator that you can gradually resume your running.
Yes.
So,
Yes.
if possible, through ultrasound or sometimes in an elite athlete, we advise MRI scan directly because it gives more information.
Yes.
So scan if possible. Otherwise, wait for the pain to subside to less than 25% of your maximum pain tolerating capacity. Do some icing rehab if possible. Have a chat with your sports medicine doctor or a orthopedic doctor or a rehab doctor or the physio. Then they'll guide you to return to activities. There is no fast cure. Only thing, the
Yeah.
body will follow
True.
its own healing process. So we
Yes.
have
Yes.
to follow the process. If
Yes.
we don't follow, then the risk of re-injury is there, and
Right.
that is a problem. So to prevent the risk of re-injury, please go through a graded rehabilitation plan.
Yes.
Yes,
Thank you. Thank you.
welcome, sir.
Eki, any more questions from the side of participants?
Probably they'll be asking when will this session be over now.
No, because
Hello, hello.
yes, Hemant.
Good afternoon, sir.
Good afternoon, Mr. Hemant.
Sir, it's been a 5 year or more than 5 years. While doing some extension and flexion in my knees, I feel a sound. I can hear a sound of tech, tech, and it gives a little pressure on my ACL. And I don't feel any pain from this. And it's been a very long time. I can hear that tech, tech sound. And many of my friends have the same problems. Sir, is it a very, does this problem will get worse in the times to come?
That's a very excellent question because a lot of people have this question. Coming to the sound inside a joint, mostly it is a normal sound. Why does the sound come? Is that we saw a picture of the joint with a cavity inside with fluid inside, and with the fluid and sometimes some air gas may be inside also. When it moves from one place to one place, we hear this tick tick sound. So like that, it can happen in the knee joint
Yes,
also.
sir.
So that is the best possible scenario. On the other side, you may have a small torn portion of a meniscus or small bone chip that is moving around that is causing this noise. So if there is no problem, no pain, probably this can be ignored. But if you have symptoms, probably you need to take an X-ray and consult the doctor and take the X-ray to find out that there is no problem, but it is only about the joint fluid moving inside. Sometimes muscle weakness can also can cause bones to make this kind of sounds. So if at all the most important muscles, hamstring and quadriceps, you can strengthen it. Sometimes the joint sound vanishes. So you can try to do that. If you try to do some strengthening exercise, if your symptoms are not bad, if your symptoms are troubling you, then please do consult medically to rule out any problems like any early arthritis or any other problems. Hope I answered your question, Hemant.
Yes, sir. Sir, I'm a regular player and I do
Excellent.
exercise regularly. That
Fantastic.
means I can feel only the tac sound and I don't have pains. That means I'm normal.
Great. So at the next available opportunity, please meet a orthopedic or a sports medicine doctor like me, and that would be a good point to clear your doubts.
Okay, thank you so much, sir. Thank you so much.
Most welcome. I'm mentioning orthopedic doctors first because there are thousands and thousands of orthopedic excellent doctors are here. But sports medicine is a new field, so maybe probably only 100 of us are there in India. So you might find a bit difficult to find us, whereas our colleagues in orthopedics are there in every nook and corner.
Thank you. Sir, I have one more question.
Please.
Related question. Whether there is any relation between tenderness and osteoarthritis?
Great. The tenderness is when we touch, if we have pain, that is called tenderness for the non-medical people. So the first symptom of osteoarthritis is pain, as well as the tenderness will be there. Where it will be there most commonly, it will be the inside portion of the knee joint, what we call as the medial knee joint, because that is where the knee joint becomes like this, and this is where the pressure goes. So that portion, the inside of the knee joint, if you touch, it will be painful. But sometimes it can come from the joint bone itself or the capsule surrounding it. So, or the meniscus might be crushed inside. So generally the inside portion will come. So definitely when the pain is there, tenderness will also be definitely there. It is sometimes tenderness may be there, pain may not be there. That can be a possibility. But whenever pain is there, generally the tenderness will be there. And tenderness is in always the inside portion of the or medial portion of the knee joint when it comes. In other joints, it can be there anywhere. So tenderness is a very important sign. It shows that osteoarthritis process is on. But the point of generation of the pain or tenderness can be bone or the capsule or the meniscus and things like that. Sometimes everything is irritated, everything is inflamed. So if you just even touch, it will be painful.
Means we can conclude that tenderness may be a sign or symptom that a person is going towards the osteoarthritis.
Yes, tenderness is definitely a symptom along with the pain.
Thank you,
But
sir.
sometimes people can have some small strain also. The medial collateral ligament strain will be there. They may have tenderness just like arthritis. But after a few days, the tenderness will disappear because medial collateral ligament will heal. So prolonged tenderness, prolonged pain, probably osteoarthritis. If they have tenderness for 2 or 3 days, then it goes away, probably. Don't need to worry about arthritis.
Thank you, sir.
Thank you.
Any more queries? Okay,
Again,
I think
they'll be asking when will you give the feedback form, when will you give certificate, when will this go? Because at the end of webinar, such questions will be asked.
no, sir. In chat box, we are receiving a chat from our participants that we have received only 5 chat that is all about the excellent session. And one, I am just quoting one chat. It is Muhammad Ikram, and he is telling that excellent session, and I wish you continue to do such webinar in future also, and he wishes all the best.
Definitely, we should do that because the COVID pandemic, in a way, has brought us all together. Otherwise, we wouldn't be
Yes,
talking
yes,
like this. So it's a
yes,
great
yes.
initiative. Thanks to the Rajiv Gandhi University administration and especially Dr. Anil and the Vice Chancellor, sir, who have been very proactive in their quest for spreading sports science and sports medicine knowledge.
Thank you, sir. And you have covered all the questions and queries raised by the participants as well, organizers also.
Right too.
It seems in respect to participants, organizers have a lot of queries and lot of doubts in respect to management of osteoarthritis. And we are really very thankful to you, sir, that you clearly explain all the doubts, either it's come from the participants, either it comes from the organizers. And we think osteoarthritis is nowadays it has been a very common phenomena, and people need to be aware that how we can manage the occurrence of osteoarthritis. And in that sense, this session may be an eye-opening for all the participants as well organizers also. Thank you for being with us. Now to
Thank you.
propose vote of thanks, I would like to invite Dr. Anil Milli, Head Department of Physical Education. Sir, please.
Thank you very much. Good afternoon to all of you. Respected Dr. K. Tyagarajan sir, all the participants, the coordinator of 5-day FDP. I'm delighted to inform you, all of you, that the University Sri Ramachandra Institute of Higher Education and Research, Chennai, is associated with us, and in fact, we are associated with them. They have a very
Both
good,
are true, sir.
sir already has shown us. Yeah, so thank you very much. So sir has already shown us the facilities and the courses which are run, and we are really, since we are a beginner, we are really proud to be associated with them, and we are really are hopeful that what CSS Center for Science, Sports Science, Srihar has done, so that they handhold us and then take to a new level where today the situation is such that physical education and sports are being separated as seen others for their own benefit, but when we see it, it is the same. Without physical education, sports cannot survive, or physical education cannot survive without sports science. So with this, we have, we have proposed for starting of courses in master, presently 4 MSc, 4 PG subjects, that is MSc Sports Biomechanics, MSc Sports Physiology, MSc Sports Training and Conditioning, MA Sports Psychology. So we will be starting the courses from this academic session only. And on top of that, we have been advised by the ministry, and Tyagarajan sir was there in the meeting. So we have to start the bachelor's degree, BSc Sports Science also, which we are in the process of framing the syllabus, and we will definitely start from this session as promised by our honorable vice chancellor. We'll try to Srihar Center for Sports Science is very advanced, and we'll definitely need their help, and then we will collaborate with each other. And one question was there regarding the conduct of more such webinars or seminars or FDP or whatever. Srihar CSS Chennai is already conducting so many programs which we have already seen, and please visit their website, and you will definitely get a lot of information. They are doing it almost on daily basis, I hope, sir, because in this pandemic all are stationed at home, and they're doing it. So last but not the least, sir, we are really enlightened through your lecture, to your experience. I think my net has gone. Am I audible?
No. Yes,
okay,
yes.
Okay. The pictures are still, so I thought the network has gone. So we are delighted with your deliberation, your experience and we are also very very grateful that the first doctor approved by Medical Council of India in sports science. Medicine has deliberated in our program. So we are really thankful. And with this, I hope that Sir Tyagarajan sir, you will be remain in touch with us, so that
Sure.
whenever we conduct any program, you are one of the speaker where there will be no questions asked. Thank you.
Most welcome,
sir.
sir.
Yeah.
Hope to
Wonderful.
see you all in person at CSS soon, and
Yes,
hope
sir.
I can also come to your beautiful
Yes, sir.
place
Yes, sir.
and
Yes,
visit
sir.
soon.
Yes, sir. So, sir,
Most welcome,
thank you
sir.
very much.
Thank you.
Yeah, and thank you all the participants for being patient in listening the deliberations and putting up few of the questions. So, with this, I thank you one and all once again. Thank you very much.
Thank you. Thank you.
Thank you,
So, Rajan sir, we will take a group photo.
Yes, please.
So that, for that, I request from all the participants, please on your camera so that we can take a group photo. Thank you, sir. Thank you for being
Thank
with
you.
us.
Thank you very much, sir.
Thank you.
Now we have announcement for our participants. Tomorrow we are going to start our first technical session at 12 p.m. and the session will be taken by Dr. JP Singh, and he will deliver his lecture on lifestyle diseases. So please be with us on time. Thank you, and be at home and be safe. Thank you.
Vivek sir, please regarding the feedback, someone was asking in the chat box. Please inform them what to do.
Sir, I have mailed feedback form to the registered email ID of participants, and today's feedback form will be also mailed to their registered email ID.
Okay.
Yes.
Thank you. Thank you very much.
Thank you,
See you
sir. Thank you
tomorrow.
all.